Hello and welcome to our monthly community engagement webinar. We thank you for staying on. We know we're a couple of minutes late, but Gary Herbst, our CEO, was jogging across campus trying to get here. And so since he's the main reason why you're on, we thought we would wait for him. So thank you, Gary. We appreciate you coming on, and we're going to be addressing a few things today. We're going to be addressing the immigration enforcement. We discussed this last month, but another question came in. We're going to talk about our financials, OBGYN and specialty care, and then round it off with a question about having a standalone emergency department. So Gary Herbst, our CEO, is here to answer all of these questions. So Gary, welcome.
Yeah, thank you, Deborah.
We're glad you made it.
Good noon.
Sliding in.
Actually, it's good afternoon now. So
Yeah.
sorry.
Yeah.
Yeah.
All right. Well, we're glad you're here. So, you want to jump right into the questions, or do you have anything to talk about before we start?
I always have lots of things to talk about, but I'll probably wait just some, notable highlights at the end, just to end on a really high note. So
Okay.
maybe we'll just jump into the questions.
All right, great. So this community member says they heard a CUIA executive saying that CUIA would not be cooperating with Immigration and Customs Enforcement, or ICE. Is that correct? And has that always been a policy? And what does that look and sound like?
Yeah. So the short answer is no, that is not correct. We work very closely with law enforcement, local law enforcement, CHP, Visalia PD, federal agencies. So we are a very compliant organization and have a good working relationship, particularly with our local police department and sheriff's department, and that will continue. No doubt about it, there's heightened anxiety out in our society. I don't know how many weeks ago, but there was a raid in I understand, Bakersfield or Kern County that had folks really anxious. And it has long been the policy of the Department of Homeland Security that with respect to immigration and customs enforcement, or ICE officers, that there were certain what they call sensitive areas that they were really not permitted to show up to. And that included schools and churches and hospitals. So there was a formal declaration or announcement by the Department of Homeland Security that those previously safe or sensitive areas were no longer off limits. And so ICE has been given approval by the federal government to apprehend, if you will, folks at schools or churches or hospitals. But we will always cooperate with law enforcement, but we will only do so if presented with a subpoena or a warrant, or, and that's the same with police as well. So simply ICE coming on site to talk to employees or patients without a warrant or a subpoena, then no, we will not grant them that. But that's the case of police and, sheriff right now too. So again, the short answer is no. Under the right conditions and following the law, we absolutely will cooperate. Now that said, it's interesting that there's another federal law called the Emergency Medical Treatment and Active Labor Act, or EMTALA, that is a long-standing federal law that requires all hospitals, irrespective of a patient's immigration status or financial means or whatever, that when they present to our hospital, we by law must treat them. We must do a medical screening and stabilize and treat them. And so we don't ask about the immigration status of our patients unless it's to help them. If they might qualify for a public assistance program in some sort, and that we have to know their immigration status, but we will explain that to them. If they don't want to provide that information to us, then the conversation stops right there. but we do not ask about a patient's immigration status. So, and there's also HIPAA. There are, again, federal laws that protect the privacy of individuals and the privacy of our patients. And so if ICE or somebody was to walk in and say, I want to know the immigration status of that patient in room 42, I, by federal law, to comply with federal law, I cannot provide that information. And again, I likely will not even know it. But so there are federal laws that we must follow, like EMTALA, like HIPAA. But that it's, there probably was a miscommunication if an executive said that we will not cooperate, because that's not the case. Again, when presented with the right information, we will always follow the law.
Mm-hmm. So what about employees? Are all employees of Cahuilla legal residents?
Yes. So that's definitely part of the vetting process when an employee submits an application and applies, for a job with us. We do a background search, on every one of those employees, and we make a determination. Do they have the legal ability, the legal right to work for us? So they may not be a U.S. citizen, but they have, through the the legal immigration process, that they have obtained the legal right to work in the United States. So absolutely.
Yeah. Social media doesn't help this at all.
No,
Because
I know social media doesn't help with a lot of things, unfortunately.
Right.
And a lot of folks now get their news, although I don't know if I'd call it news, but they get their information from social media, and unfortunately it's not a good place.
Okay, so let's talk financials. January's financials.
Yeah, I mean, over the last 4 or 5 years, I haven't really wanted to talk about financials, but so January was a very good month. And generally, I would say, the respiratory season, January, February, March, traditionally can be good months from a financial standpoint, although during COVID, not so much. But we were incredibly busy in the month of January. Definitely, and that's continued into February. I was looking at our census this morning. We're 100% occupied. I think we were holding 27 admitted patients in the emergency department waiting for a bed to open up upstairs. But it's not just respiratory, although we're having one of the worst flu seasons that we've seen in maybe 10, 15 years. RSV's kind of subsided. COVID really hasn't, been that big of an issue this year. Definitely the respiratory admissions primarily relate to the flu. But we've also been very busy in surgery and cardiac, our cath lab, endoscopy, virtually all of our inpatient and outpatient services, very, very busy. That generally translates into, higher than normal revenues, but generally does result also in higher than normal or budgeted expenses. But we did have a positive operating margin. So we were in the black for the month of January. We had a $3.4 million positive operating margin, and we'd only budgeted for about a $600,000 positive operating margin. So definitely exceeded that expectation. Our patient revenue, so we have revenue from various sources, but the predominant source of our revenue is taking care of patients. So what we receive in payment from Medicare, Medi-Cal, Blue Cross, Blue Shield, other payers, we brought in $62 million in the month of January, which was almost $7 million higher than what we had budgeted. Again, really driven by the really high patient volumes. Now, expectedly, we also were over budget in expenses. So labor, we have about 141 traveler nurses that are here right now. Fortunately, we're only paying about $100 an hour compared to the $200 to $300 that we were paying during the height of COVID. So we did come in over budget in expenses, but only about $1.5 million. So over budget, almost $7 million in revenue, 1.5 million over budget in expenses. So so it ended up being a good month. Now that said, we came into the month of January, so our fiscal year starts on July 1, so we're now 7 months through it. So even with that positive January result, our year-to-date results are still a negative operating margin. So down, it's decreased from where we were at the end of December because of the positive January, but we still now have a 7-month year-to-date operating loss of 16.4 million. But that was not unexpected, as I've talked about in previous months. Just the significant increases we've had to give in compensation and benefits. Also, greater use of traveler nurses than we'd expected. But even with that $16.4 million actual operating loss, that's $1.5 million better than what we had budgeted. So we actually budgeted to have an operating loss. Now, that all said, we still are expecting to receive about $47 million in FEMA funds. So
where is that now?
Yes. So we are in the final stage. I would even say we can see the finish line.
You can smell the money.
Yeah, it's a faint smell. Let's say that. But I think I'd reported last month that it is now in the hands of the California Office of Emergency Services, Cal OES, the final stage. Although the final stage, amazingly, frustratingly, is still a number of hoops you have to jump through. So we have been assigned a dedicated representative of Cal OES that's making the final review of our submission, making certain that we didn't get already paid for the services that we're seeking reimbursement for, which are predominantly extensive use of travelers at a very expensive rate. So I would expect in the next few weeks that we will clear that final hurdle, be given final approval, and then I'm disappointed to hear that it actually goes back to FEMA for the check write. So, and we all know what's going on at FEMA right now and the new administration and the threats being made to either, cancel the FEMA department or agency or, completely overhaul it. The funds are there. They've been appropriated previously by Congress, but they will ultimately do the check write. So until I see the check clear the bank, I will remain cautiously optimistic, but probably confidently optimistic. But
So they were sent to the state fully obligated.
yes.
And now another hoop we've gone through. And now they've got to go back to FEMA.
After Cal OES says, yes, everything is buttoned down, write the check. Or probably it's a wire transfer in this case. But the funds, I thought they actually had already been sent to California, to the Cal OES. But apparently the funds are still sitting in the FEMA coffers in the bank, waiting to be given that warrant by Cal OES to release the funds. So as I talk to Melinda Tupper almost every day, Melinda, help me sleep tonight. She's Gary, everything is going according to plan. There doesn't seem to be any hiccups. We're not getting any signs that there's risk here, but these are unprecedented times, and definitely the monkey wrench of the new administration coming in and making the threats. And so that's why in this case, until the money's in our bank account, I'm still going to be a little restless.
Okay. All right. Thank you for that. All right. OBGYN. That's we've been saying it for the last few months. It's a hot button item. And I have 2 daughters that are in that phase of life, and they're both looking to have babies in the next year. And has anything happened since our last webinar?
Yeah, certainly the crises has not been resolved. I would still say we're in crisis condition. We continue to deliver hundreds and hundreds of babies every month. In fact, January was a very, very busy month. A very high number of babies were delivered safely and beautifully here at Kauai. So I want to continue to thank all of our obstetricians that are on staff here and stepping up to help us deliver safe deliveries in a very wonderful way for our moms. We continue to work very closely with the South Carolina-based group called OB Hospitalist Group, or OBHG. I've shared with you in the past that they staff more than 200 OB programs across the country, hospitals there. A lot of our obstetricians have worked with them in the past. Dr. Paul Stefanacci, who is our Chief Medical and Quality Officer, he has worked with them in the past and had great experiences with them. So they come with a very solid reputation. We have actually signed a formal memorandum of understanding with them. We literally meet with them weekly. We were informed yesterday that they have taken 2 of their obstetricians from an existing program and will be deploying them here to Kauai so that they will be ready to go on March 10th, which is the date that our existing arrangement with our local laborist group ends. However, Ryan Gates and I just met with about a half a dozen of our local obstetricians who are staffing our laborist program. So Dr. Vincente, Dr. Banks, Dr. Beatree, Dr. Sabagal, Dr. Kadimi, they are members of the current laborist group that primarily they're limited to just delivering the babies of unassigned patients. So when a mom does not have a formal relationship with a local obstetrician, they're considered unassigned. And if they come here to deliver their baby, then one of those laborists steps in and delivers that baby. They also have covered for local physicians too. Dr. Vincente was sharing a story with me that a local obstetrician had a conflict, couldn't make it in, and asked if Dr. Vincente would deliver their baby for them. They said absolutely. Even though they didn't have the responsibility to do that, our obstetricians, they work really, really well together. And I applaud them for that. They cover for one another, always have each other's back. And so we would love for them to participate in this more expansive OB hospitalist program, which is more than just delivering unassigned babies. It's actually being here in-house 24/7, willing to deliver for any obstetrician. More and more, an obstetrician like Holly Quinn, who's a new mom herself and wants to have more children and doesn't want to come in at 2-3 o'clock in the morning and deliver a baby, or wants the weekends off to be with her family. More and more hospitals are implementing these hospitalist programs so to provide relief to those obstetricians, which I think is a great selling point to be able to attract more obstetricians here that, hey, come to Kauai. We have this hospitalist program that has highly trained, highly qualified obstetricians that will deliver your babies for you so you don't have to come in the middle of the night, or you can have the weekend off. I think that's going to be very attractive for more and more physicians. More and more obstetricians are female too. It's changed rather significantly over the years, and they want more of that part-time work. So things are moving along from that standpoint. I'm very hopeful that a number of our laborists who were arranging a meeting with them and the OB hospitalist group to see are there opportunities for them to work for them so many shifts a month, or maybe to cover for the weekends and so forth. So we'll see how that actually plays out. I continue to work closely with Family Healthcare Network and Altura, two very large family or federally qualified health centers. They probably are responsible for about 40% of our annual deliveries. So very, very busy obstetrical groups that also have been experiencing a lot of instability. And so they're very interested in what the hospital is trying to put together with this OB hospitals group. And we're hoping that they will partner with us and help participate in that program as well. We have, offers out to obstetricians, both what they call locum tenens physicians, which are kind of like traveler nurses, but they're traveler physicians. Very commonly used throughout the country. We've used them in our adult hospice program and other areas as we recruited for more permanent physicians in those specialties. So we are trying to onboard a number of those OB locum tenens physicians, as well as actively recruiting for permanent obstetricians. I will say that the offers that we're making in terms of guaranteed salaries and benefits and sign-on bonuses and student loan support, relocation support, we are hearing back from those candidates that they are outstanding offers. So we're not being cheap. So we're willing to spend the money to shore up our obstetrical capabilities here.
Yeah, thank you. So this community member says, it feels like the county's becoming a medical desert. It starts with specialty care, which we've been struggling with for several years. And now it feels like even basic services are hard to find here. And they mentioned urgent care, walk-in clinics, primary care, OBGYN. So, but then they also said it seems like Cahuilla is carrying most of the weight of recruiting doctors. Do other healthcare facilities help with recruiting, or do they just rely on you to bring everybody in?
Yeah, it's a great question. Obviously, a multifaceted question. Without a doubt, the role of hospitals, which more and more we're becoming, health systems. It's really why we rebranded ourselves from Cahuilla Delta to Cahuilla Health, as virtually all other large hospitals in the state have done to recognize that we have really grown into a health system, not just a hospital, but really through our affiliations with the medical community and medical groups and so forth. It's kind of a partnership that makes up the Cahuilla Health system. So it used to be in years past that it really was left up to the medical community and individual physicians and physician groups that they would do, the heavy lifting and recruiting new physicians into the community to join their groups. We would oftentimes provide them with some financial support to help them with that, but we were really kind of on the sidelines with that. Now we definitely are at the forefront. It's really the hospital and the health system that's really driving physician recruitment and the expansion of physician resources in the community. We're not doing it alone by any means. We still are absolutely partnering with the local physician community, but they are coming to us and say, we don't have the bandwidth, we don't have really the time to be able to devote to physician recruiting. We actually have a physician recruiting department led by JC Palermo and Mark Mertz, our chief strategy officer. And so we have dedicated resources to help us recruit physicians into this community. And if a physician says, I want to recruit one or more physicians into my medical group, that's great. I was telling our board last night that we're really kind of agnostic when it comes to bringing new physicians into the community. We don't care if they come to work for Cahuilla and work in a Cahuilla clinic, or I'm happy if they come join Visalia Family Practice or Orthopedic Associates or Altura, our Family Healthcare Network, or join one of our clinics, or our cardiology group or Key Medical Associates. I just want to bring them to our community where they will want to stay and practice. I certainly want them to be loyal to Cahuilla. I want them to use our ancillary services, our diagnostic and therapeutic services. when their patient needs surgery or endoscopy, I want them to use Quia facilities, but I just want to get them here to our community. Now, that said, it definitely is more difficult recruiting physicians to the Central Valley, and it always has been. The Central Valley, the San Joaquin Valley, has one of the lowest population to physician ratios than anywhere else in the state. And the fact is, we just don't have the amenities and the resources, that more metropolitan areas have. Generally speaking, when you're recruiting a physician to this community, you're recruiting their entire family, their spouse, their significant other, their children. So physicians are no different in terms of, it's a family decision. And so they're looking at schools and parks and weather and air quality and amenities. They're looking at safety and education and health and so forth. And so a lot of times a physician will see this as a wonderful practice environment, but their family is not happy with it. So we all play a part. Our entire community plays a part in successfully being able to recruit and keep physicians in our community. Mm-hmm. Now, with that all said, I know it might feel like a desert, but that might be a perception because we recruited 19 new physicians to the Quia Health System, to our community this last year. And J.C. Palermo had given me a list by name. I forgot to bring it with me, but they cut across many, many different practices. So child psychiatry, medical and radiation oncologists. We now have a dedicated orthopedic traumatologist, Dr. Dean, who does nothing but work in the hospital, taking care of orthopedic trauma cases. We brought new anesthesiologists, interventional cardiologists, Dr. Shahil. We're actively recruiting for another electrophysicist who does the electrical part of the heart. Outpatient psychiatry, dermatology, cardiothoracic surgery. So Dr. Bodgel, Shelley Bodgel, not Bodgel, excuse me. Is it Bosnell?
Which one?
Bonzel.
Gosh,
okay. Sorry. Shelley Bonsel, a cardiothoracic surgeon that's coming to us from Missouri, joining Dr. Mayer's group. She will be here, I think, first part of March, so excited about her. A pulmonologist. This is a rarity. So we have been without an outpatient pulmonologist, despite a significant presence of constructive COPD, chronic obstructive pulmonary disease.
You're good.
I'm dangerous when I'm, COPD and asthma and other, chronic respiratory conditions that unfortunately are exacerbated by, some of the challenges we have with our air quality. But he will be arriving, I believe, early this summer, a dedicated outpatient pulmonologist coming from Alabama joining us. So we're very excited to have him. Family medicine, general surgery. We have more urology coming and another rheumatologist. So cutting across many of the specialty services that we need in this community. So we have only lost, that I'm aware of, 2 primary care physicians. That unfortunately, very sadly, Dr. Rafael Martinez, who's going back to United Health, going to Hanford, but he said he's only going to be there for about 7 months. Then he's coming back to Visalia. So, and then we lost Dr. Angela Papp. She and her husband, Dr. Mascari, who is a neurologist, decided to move to Santa Barbara to be by their son. So very disappointed. But we really aren't seeing many physicians leave this community, and 19 more physicians, and those are just those that we helped recruit here. So we definitely need more physicians, without a doubt. So the person that sent in this question that is feeling like a desert. I get that because as our population grows, and if we're not adding physicians at the same rate, and every 2 years we conduct a very comprehensive, medical staff needs analysis, and it absolutely you go down almost every specialty, and I think nephrology and podiatry might be the only specialties where we actually hit the benchmark in terms of those specialties per 1,000 population. But every other specialty, we have a shortage. And so it's going to be like painting the Golden Gate Bridge. We will never stop recruiting physicians into our community.
Yeah. So the last part of that question is about city and county leaders. And I think their intention around this question is, are they aware of it? Which we know they are. We have a very good partnership with the city and county. But a lot of times people think, well, that's their problem. And so, but it's all of our problems if we cannot provide physicians.
Yeah, absolutely. And the three tenets to a thriving society are the same for Cahuilla, the city, and the county: health, safety, and education. Mm-hmm. That's true of every community across the country. And so we are all on the same page: Cahuilla, the city, and the county. As you said, they've been great partners. Mark Mertz and I meet with Leslie Caviglia every month to talk about mutual, things of mutual interest, and definitely keeping them well informed about, our medical community and the available resources and access and so forth. Leslie attends virtually every event. When we invite our new residents, Leslie and city leaders are there, councilmen and women are there. They've gone to Sacramento to advocate on our behalf to expand funding for healthcare, which right now there is a bill that's before the state legislature that would provide for the very first time state funding for graduate medical education for district hospitals specifically. There are only a few of us, of the 33 district hospitals, that actually have graduate medical education programs, so Cahuilla being one of them. So the city and the county have written letters of support for us. We're working with the county right now. They own the Cigna building on Acres. That's where the sheriff's office is located. And we are in the midst of negotiating a lease with them to lease 13,000 square feet on the bottom floor of that county-owned building to develop into medical offices. So that's one of the hurdles in recruiting new physicians to the community is, where am I going to work? There are not a lot of medical offices throughout the community. And so we're very appreciative working with the county, to be one of their top priorities, to partner and create that space to be able to place new physicians that we recruit into the community. So they're very involved in helping us recruit.
Okay, thank you. So last question, I was involved in a conversation with some community members, and one of those members had been in Texas and had saw standalone emergency departments in most of the towns that they went to. And so they asked me, could we do that? Could we have a standalone emergency department away from the hospital to take some of the weight off of our current emergency department?
Yeah, it's there are a number of states across the country. I think it's in the 20s. I don't know if they outright authorize the approval or the approval of standalone EDs or freestanding EDs, FEDs as they're called, freestanding emergency departments. While they don't necessarily explicitly authorize them, they don't prohibit them in their state health and safety code. So in California, it is prohibited for standalone emergency departments. They do not allow in California, except for a standalone emergency department in the city of Paradise that suffered through that tragic campfire that destroyed a great part of that community, that town. Also really damaged their hospital, the Feather River Hospital. And so a bill was passed in 2019 by the legislature, signed by the governor, that allowed Adventist Health to build and operate a freestanding emergency department in the city of Paradise. So that's the only one I'm aware of so far. I believe the state law permits the state to make exceptions for rural communities. But as the law stands right now, the Health and Safety Code states that an emergency department must have surgical services and critical care services to be licensed as an emergency department. So we definitely would not meet the rule exception in Visalia, which I think is what this person is kind of suggesting. Could we build another standalone emergency department in Visalia to take pressure off the emergency department in our downtown medical center? So the answer, as far as everything I could research, is a pretty definitive no. Now, what we can do is we can develop more urgent care centers. We can develop more clinics. We're getting ready to open our second clinic in Woodlake. We're exploring potentially developing other rural health clinics in those communities that don't have an extensive or any amount of primary care services. So, we operate 5 rural health clinics, soon to be 6. We didn't just go into those communities of Woodlake and Lindsay and Dinuba and Tulare and Exeter just on a whim or throwing a dart. We looked at all those patients that are coming to our emergency department for non-emergent care. Where do they live? And we found a predominant number of them lived in these communities. And when we went into those communities, we did not find an extensive presence of primary care or access. And so those 5 rural health clinics last year did more than 150,000 visits, that many of them would have come to the ED in the past had we not had those clinics. We have 2 busy urgent care centers that are really struggling right now for access. And I know it's a chief complaint of our community right now, is that those urgent care centers, they fill up almost immediately. We allow people to go online and schedule an urgent care visit so that they can wait at home or wait out in their car and not wait in the waiting room where there's a lot of sick people, that are there with their colds and flus and that you don't want to be exposed to them. So for safety and just, better experience being able to wait at home, you can go online and schedule an appointment at the urgent care center. You can also walk in, but this is kind of like virtual walk-in. But what it appears when you walk in physically and there's nobody in the waiting room and you sit there for hours and hours and hours, and I'm sorry, there's all these people ahead of you and you don't see them except when they walk in the door and then go right back. It's because they're coming from home. They schedule their appointment maybe the same morning, maybe the day before. So we're looking at that whole thing, but the thing that really is challenging us right now is providers. We don't have enough providers, physicians, physician assistants, nurse practitioners who generally staff. There's just a shortage of them right now. So we are heavily recruiting them. We want to expand our capacity in our urgent care centers to go deeper into the evenings, to have more slots available, to be able to take both physical walk-ins and continue to accommodate those online scheduled appointments. So I know that's frustrating right now, but I think that's more of our solution to easing the volumes in the ED, is to continue to develop more clinics and more urgent care centers.
Okay, thank you, Gary. Well, you've answered all of the questions, so you have some good news
Okay.
for us?
Yeah,
Please?
I do. So Saturday night was the 3rd annual Kauai Health Hospice Foundation Moonshine Soiree. That's a mouthful. The Moonshine Soiree. It was held at the Visalia Country Club. It was packed. In fact, unfortunately, we had to turn people away because we had met the fire marshal's maximum capacity for the dining room at the country club. But it was a great event, great turnout, lots of money raised that night. I think I heard from Ben Cripps last night, who sits on our foundation board, that so far the preliminary tally is we raised about $170,000 to support the Kuya Health Hospice program. So thank you to all of you who may have attended that evening, who in the past have given generously to the Hospice Foundation. It is a wonderful program led by Doctors Ryan Howard and David Sine. Dr. Howard oversees the adult hospice and palliative care side of the program. Dr. David Sine oversees the pediatric side of the hospice program. You know, it's always sad to hear. I mean, we want those programs to be busy, not because, you know, of death and dying, but we know how much support they can provide to patients that are at end of life and their families, just helping support them and ease that burden and to give them dignity and you know, so much say in their end of life decisions. And so somebody, when they have a terminal illness, being able to get them on hospice as soon as possible, because a lot of our patients don't get onto hospice until 2 to 3 days before they pass. And so we want the hospice program to really be successful in supporting the end of life needs of our community. I was really, you know, saddened to hear that I think we have close to 85 children that are on hospice. So sad to hear that, but really appreciative to Dr. Sine and our staff and everything they do to help support those children and their families. But
didn't you think that was a touching moment when Reverend Harry Wood got up to do the prayer and mentioned the hospice house, which is named after his late wife,
Ruth Wood.
And that was, to me, that was one of the touching, lots of touching moments that night, but that was really sweet.
It was, yeah, absolutely. And Stephanie, the daughter of Tony Salerno and Mary Salerno, and just listening, Tony ended up being a resident of the Ruth Wood Hospice House.
And his son. Like,
yes.
Crazy.
But just, yeah, the wonderful care that they received. And so that was definitely a highlight of the week. Both you and I were there in attendance, so had a lot of fun. And then last night, I don't know if you caught it on CBS Channel 47. It was on from 7:30 to 8 o'clock. But myself and Jag Bath, our Chief Operating Officer, Dr. Matthias Daniels, and Dr. Frank Feng, two of our fellowship-trained orthopedic spine surgeons. We were highlighted on CBS 47. Catherine Herr was the reporter that interviewed all of us, but they highlighted our incredible spine surgery program here at Kuya Health, which was just named as one of Healthgrade's top 100 spine programs in the country. This was the first time that we had received that top 100 award. And so it was wonderful it came at no cost to us. So Channel 47, who has been a great partner of Kuya, I think this was our third time that we've been invited to come talk about Kuya Health. The last time was also in February, where we celebrated Heart Month, but to talk about our award-winning heart program here. But if you get a chance, I would imagine we might be posting that telecast on our Kuya Health website, but had a lot of wonderful information about the work of Dr. Daniels and Dr. Feng, as well as our other spine surgeons, our neurosurgeons, that do provide wonderful spine fusion and spine surgery. But that was a great highlight of our program here. So,
all right.
yeah, so definitely two wonderful positive things to end on. I probably should have done my financial report at the end too, huh?
Probably. Well, thank you all so much, and we'll see you next time.
All right.